as a new grad, I just found the whole thing pretty overwhelming, like jumping into the spaces. I'm sure a lot of new grads do. Come out from the end of uni, I had so much less knowledge, experience, and skill than I thought I had. And especially going into like country practice, oftentimes I was there by myself, trying to do my best. But to the point where I was like, actually, I don't know what I am doing here. And it was scaring the crap out of me. And it just made me like super anxious and not really like the job too much, to be honest. And so that first like year of my dental career was like a time where I was like, wow, what have I done? Is this actually it now? Like, is this my career for the rest of my life? And this is what it looks like? Because I wasn't really enjoying it, and I wasn't like my happy self. I was kind of like super stressed out.
CPD Junkie Dental Podcast is about connecting with passionate Australian dentists who are improving themselves and have attended various CPD courses. My aim is to find out for you the best CPD courses around and what they did to help get them to where they are today. So you can consider doing it and becoming the best dentist you can be quicker. Hi CPD Junkie fam, I'm your host Laurence Doan, and today we're joined by Dr Matt Hedge. Dr. Matt Hedge, welcome to the show.
Thanks for having me.
So, would you attribute some of your interest in dentistry to a family friend back in Port Macquarie?
Yeah. So growing up, we had a family friend who's a dentist down there, Mark Brisley. So I was seeing him as my regular dentist, didn't know what I was going to do as a kid. And then one day Mum just said, why don't you go, spend a day with Mark and just see what dentistry is like. And I thought, can't hurt, we'll give it a shot. So didn't really have any major like thoughts about it. We just did it, went in, kind of really loved it. Loved everything that he was doing, the vibe that he had in there. Had a super nice, super chill clinic with really cool staff. And by the end of the day, I was like, I want to do what this guy's doing. It was really cool. So I chatted to him about it, and he said, look, if you want to, chase this, let me know. I'll help you. Like, I'll help you up the application and all of this. And I thought, hey, why not? Like, once again, let's just give it a shot. We'll see what happens.
Yeah. Fast forward to today, you're a dentist now.
Yeah. So, and here we are.
Yeah. So then what happens when you graduate, right? So you graduate from dental school. So where do you go to there? Do you go back, or do you end up on the Gold Coast somehow?
Yeah, so I was at uni in Orange, at Charles Sturt University in Orange, and graduated up there in 2015, and then went back to Port Macquarie. I mean, it was the safest thing to do, right? Back to home, somewhere I know everybody and could like kind of start things off. So I worked both in public and private there for I think 2 years. I was back at home before I started to get bored and then decided to, shake it up a little bit and move to the Gold Coast, try and find something different, kind of reinvent myself there and have something new and different and exciting. So it was really cool.
So let's dive into that a little bit. So you mentioned you're doing both public and private, which is like for a lot of people when they first graduate, it's kind of difficult, I feel like, because in the public, in my experience, is that they either want you full-time and they don't want you, doing part-time. So how did you find juggling that?
Well, I didn't actually juggle it. So I started off in private. And as a new grad, I just found the whole thing pretty overwhelming, like jumping into the spaces. I'm sure a lot of new grads do. Come out from the end of uni, I had so much less knowledge, experience, and skill than I thought I had. And especially going into like a country practice, because I was in Port Macquarie, but I was also in a number of like small towns around the area as well with this practice. And so oftentimes I was there by myself, like just, trying to do my best, and was really kind of got to the point where I was like, actually, I don't know what I'm doing. I don't know what I am doing here. And it was scaring the crap out of me. And it just made me like super anxious and not really like the job too much, to be honest. And so that first like year of my dental career was like the time where I was like, wow, what have I done? Is this actually it now? Like, is this my career for the rest of my life? And this is what it looks like? Because I wasn't really enjoying it, and I wasn't like my happy self. I was kind of like super stressed out. So that came to the point where I was like, how can I alter this and modify it? How can I make it something, different? I thought, public seemed like, from what I'd heard and what I'd spoken to people, it was going to be a good opportunity for me to kind of have some mentorship and some growth and learn. And it really was. I worked there for maybe only a year or so, but I thought it was really good. I learned a lot about how to treat things and how to treat things fast, as you have to do in public system, because you've got like half an hour appointments or whatever we have, like toothache for half an hour. So you get pretty efficient at doing things, but whenever you get stuck or whatever happens, there's always someone to help you. There's no there's no stress or pressure from the top. So I found it was a really good time for me to kind of get comfortable in, basic treatment, just how to take out teeth, how to do fillings, how to talk to people, and all of that without having the stresses of like money and finances and, time constraints and business things on top of it. So it was really good.
Yeah. Well, I mean, I want to unpack this a little bit more, because it's actually an interesting topic, because I'm talking to a lot of graduates as well, or new graduates, and they're like, oh, there's this like an amazing opportunity, but I'm like, is there someone to support you? And they're like, no, but then they're like, it's all right, I'll if I just dive in, I'm sure I'll be able to somehow survive. But to your point, obviously you were struggling. I mean, at the time when you got this job, were you thinking, sure, like if I just do courses or whatnot, it would supplement it? How did you kind of get through that, to like difficult moment?
I think it's really hard. I think, there is always a degree of like sink or swim when you start as a new graduate. And regardless of if you go public or if you go private, if you have mentorship or not, I still think most people are going to have that feeling that they're like in over their head and they've taken off more than they can chew quite often. I think that doesn't stop, at certain points in people's career. But like obviously I think I've done things in my first couple of years that if I could go back, I'd do it a little bit differently. I think I would, to like explain the story of when I went back to Port, I didn't end up working with the initial dentist that got me through. And when I look back on it, a part of me is like, if I did work with him, I would have probably had a lot more of that one-on-one mentorship and had a lot more growth there. However, I'm also glad that I didn't, because I would have got really comfortable in that, and I think I'd still be in Port Macquarie, which is not a bad thing. But I grew up there, I spent my whole life there. It's like I needed to spread my wings and go and somewhere else and do this whole new chapter, and I wouldn't have done that if I was comfortable. I needed that discomfort to kick me in the butt and say, hey, you've got to start again, try something new and do it. And often that's it takes a fair bit of a push for you to do something like that. So in a way, idealistic world, I'd probably change things for my first couple of years, but that's what I needed to do what I did to get where I am anyway. So
yeah. So let's dive. So you go from private, then you go public, because you're hearing like you need some support and it's got a great opportunity, and you do that, but somehow you leave that to go on to something else.
Yeah. Crazy, right?
Yeah.
Yeah. I guess, the goal for me wasn't always like, stay public forever for me, because there are a lot of limitations, I find, maybe not for everybody, but for like what I wanted to do and my dentistry. And I just find like it was such a great place, and you could definitely be very comfortable having a really great career there. However, that's the same thing that I went back to before, like, comfort, that I kind of need something to grow. I need need a challenge to kind of make me do better otherwise I get bored and then I'm unhappy. So I think a lot of dentists are not everybody, but I think there's a lot of dentists out there or new grads that are like that as well, is that we kind of thrive off the challenge and having stimulation and things. And me personally, if I'm like if I'm not stimulated, if I'm not challenged, if I'm not doing things that are pushing me a bit, I just get stagnant, and then I get bored, and I'm probably not my best or my happiest self. So
Yeah.
kind of, where I was like, I get to the point where I'm, I've learned a lot from this career, but there's a lot of aspects of dentistry that I can't do out of there,
Yes.
the aesthetic treatments and things, which I really love. And I've always, been like, man, that'd be really cool to learn that sort of stuff and to do that. If I stayed public, I wouldn't have the opportunity to chase those kinds of things. So I had to, take a bit of a plunge and jump out. And I moved up to the Gold Coast because I had an opportunity to work up in the Gold Coast, and it worked out well.
Yeah. So tell us about that opportunity when you're in the Gold Coast. So what happens? You arrive in a place where you practically don't know many people. It's a new kind of environment. How do you kind of dive in, working in that place? How do you find, your roots?
Yeah. Well, it was actually one of the nurses from my initial practice that I worked at when I graduated. She'd moved up to the Gold Coast, and she was working at Pacific Smiles. And I was looking for things, and we'd got chatting and whatever. And she said, "Oh yeah, I could probably get you a job up here." And I said, "All right, let's have a look." And it just worked, it just all fell into place like that.
Yeah.
So it was a very easy, transition into that position and role. Obviously, going straight like from being public for a while back into private is a bit of an adjustment again,
and corporate at that.
Yeah. And I don't have huge amounts of experience with other corporate practices. Like I've heard plenty of things, both for and against, but my experience was good. And I think it comes down to like an individual, like how each practice is run. Like you could have a great one or a crap one, whether it's public, private, or corporate, whatever. But the practice that I was at had a really good practice manager. She was very, very good, and the team was great. Like everyone got along really well. So I never had like any kind of like push for like KPIs, any of that sort of stuff. And they would like very fair and reasonable the whole way through. So I had a really good experience. I've heard others that haven't had for other corporates and things, maybe not as good an experience, but for me, it was all quite positive. So
I think what most people don't realize is that corporates they themselves very dependent on each clinic. So each clinic it's not like, oh, you just because you've joined this corporate, they're all the same. It's like their own little thing at the same time.
Yeah. There's still a practice. So I think, you could work for a corporate that has less than ideal situation, but if you have a great team around you with people that you get along with and everything else, you're still probably, for the most part, enjoy your job. I think it's a lot about who's around you. So, yeah.
So I want to talk about your type of dentistry. You mentioned that when you're in public, you're thinking, I want to do these cosmetic cases. And so then you end up moving to the Gold Coast at this time, and you're in the corporate. Are you doing more of these corporate, these cosmetic cases that you're kind of wanting to do at this point?
That was when I kind of dipped my toe in. That was when I sort of started going, like, what can I do? Some little things and pieces. And I started working on like doing some, minor like edge bonding sort of things, or, doing some crowns or veneers on front teeth that I normally wouldn't have done before. And a lot of that was kind of, for me, when I think that, to be honest, Instagram started, like that whole generation of like people were putting stuff on Instagram, or even like DPR at the time. And, probably just prior to that, where people were putting up cases, and I was seeing like Barat, and I was seeing Niall, and I was seeing these guys posting these cases. I was like, man, that's cool. They're doing some awesome stuff. Like I would love to. And one way or another, I ended up talking to Barat, and he was like, oh, well, just start doing some stuff. I asked some questions. He gave me some answers, and he kind of, helped me out with a couple of cases. And I'd do these cases, and they were okay, not great. And I'd send him photos, and I look back at these photos now, and I'm like, oh, damn. But like, that's how you start, that's how everyone starts. And everyone's amazing from the get-go, and you just keep learning. But so yeah, I had that kind of drive for it. And then Barat was kind of going, why don't you just come and work for us, and I'll teach you. And I was like, nah, man, I'm not good enough. Like, I had that like whole like self-conscious kind of thing going on where I was like, I'm not up to that standard. I've seen the work that you guys publish and, I'm not there yet. And he's like, how do you think you can get there? And so eventually I was like, yeah, let's do it then. And so that was when my journey with Oasis started, and mentorship with Bharat. So yeah.
Right. So, I mean, talk to me about some of these courses that you might be doing to kind of complement it. Are you doing any courses, or are you kind of just really just sticking your head into, working and then just trying to implement some of the things that you might be seeing? How do I replicate it? Like, how are you learning?
Yeah, I think it's a bit of both. Like you've got to, I think ideally, and it's not everyone's going to have the ideal situation, but ideally you've got some courses that you're doing or that you've done, you're doing your reading or whatever online, you're sussing out all the techniques and doing all that. And then you've got a mentor to help you and, guide you into implementing that. Because I think the hardest part is that when you start to learn a skill, actually implementing it is scary and hard. And there's so many things that you need to look out for that you don't know. So it's definitely a lot harder without a mentor. But I've done a few aesthetic courses like that. I think for me, as far as going for someone who is looking at something to get into composites and things on anteriors, I think one of the best courses would be Sahil's. He does like a composite veneer course, and it was excellent, like super practical, super guided step through for everything. It really made sense. And I think I took a lot out of that course. So that's a really good one. I'm sure he's still doing that course. I'm not sure, but it was really great. I think he's a really good teacher, and I really recommend that as like a starting point. I know Bharat and Johan have got their BXY course. I haven't done that because I was working with Bharat as kind of their point. But I've heard it's really good. And if it's like his mentorship one-on-one, I'm sure it's really excellent as well. So I think they're both be really good beginner courses. And then for people who really are interested in it, I think Tony Rotondo, learning from him is a really great thing to do. But I think you've got to you don't have to, but I think you'd benefit more if you have a bit of understanding of aesthetics and have a little bit of hand skill to start with.
Yeah.
He's really, so incredibly talented and detailed and refined that I think if you've got a little bit of skill already and you can refine that skill, then that's a really good course to do.
Yeah. Okay. So then how do you decide what kind of courses, how are you deciding that this is the course that you wanted to do amongst all that? How did you find it? Like, how did you go about deciding?
Yeah, I think earlier on it was pretty hard and it was a lot of word of mouth. But to be honest, back in the day, it was a lot of like DPR, to be honest. DPR was, you Google things or you search it on DPR and see people's reviews, or you check out, you check out what other people are saying or ask other people. And I'd always see guys like Sahil on there and be like, oh, does really great work, seems like a really good guy. So I kind of, a lot of mine just was doing it and hoping for the best, and I was really lucky in that pretty much everything that I've done has been really valuable and worthwhile. So, now with you guys, having like a directory for it way easier for people, but yeah, then it was kind of try it and see what happens.
Yeah. So you go and attend this course. Are you doing any other courses around this time as well to kind of complement your skills?
Yeah, so I was doing some clear aligner stuff as well. I was doing a diploma in that with the postgraduate school of dentistry. So that was actually really quite interesting in that, it's talking about clear aligners, but there was a huge emphasis on overall facial aesthetics. And even though I do hate bulk theory, as we were just chatting before we started, and there is a lot of theory in it, but I do think it really was good in shaping the way I now see and work, in the entire face, not just a smile. And I think that's a shortfall sometimes that people get caught up in just looking at this little area instead of looking at the face. It's like, yes, they're nice teeth, but does that complement someone's face, their lips, the shape of their head? Does it suit their kind of character? Does that smile look good within their face, or are you just creating a nice smile that's like a generic smile? So that funnily enough is one of probably the biggest things that I took from going through that course and looking into that.
Mm-hmm. Was there a reason why you picked clear aligners first as opposed to maybe fixed traditional orthodontics?
Yeah, once again, it comes back to what I was just saying, and planning for that whole face. Like, it's just so powerful now with digital technology, being able to scan, being able to take photos or 3D scans of the face, and being able to plan that from the start. That's just, for me, is how I do every case, and I just don't think there's anything better than that at the moment. Like, I think that should be the gold standard, because there's so many times where I look back on cases that I've done years ago with clear aligners before we had, before they would incorporate for Invisalign and things, the face photos in now that we use. And I just think, far out, like, how was I doing this before, when I was just looking, like I said, just looking at teeth and a mouth without considering the overall face properly? Yeah, you got photos, but it's really hard to assess moving objects on a static photo that's off to the side, without considering like your vertical movements and things. Are you going to create more of a gummy smile, or are you intruding things? Are you balancing them with the lip? All of these kinds of things that I think would be very difficult to do with braces alone, unless you were doing braces and then doing some digital sort of stuff at the end to kind of align them up.
Mm-hmm, mm-hmm. I'm gonna bounce back a little bit, because I'm trying to frame the story for the listener who's kind of trying to follow along. So you graduate, you go in private, then you go to public. I mean, public's a tricky setting to take photos, because it's a short amount of time. Because you're talking about all these aesthetics that you're trying to implementing, but you're at this time you're thinking about aesthetics. So at what point does photography, all these orthodontics, all these aesthetic stuff starts to really kind of come about? And is it when you're moving to the Gold Coast at that point?
Correct. Yeah. It wasn't until the move to the Gold Coast then I started doing these kinds of aesthetic treatments and looking into that, and being keen for that. When I was in Port Macquarie, when I was working across the public and prior to that private, I was really just trying to survive normal dentistry. Like, that was me just building my foundations, being able to function and do normal treatments, being able to do fillings and extractions and do them efficiently without taking forever, just being able to see and talk to people. I think like those baseline fundamentals are so important to be able to do really well. Sometimes I think what I see now with new graduates is that they're also really keen to do all this stuff, which is great, but you've also got to have that foundation, skill. So you've got to be able to still be able to take out a tooth if someone comes in pain, and you've still got to be able to communicate with people, and you've still got to be able to, comfortably get the fillings done without, absolutely having a horrible appointment that you hate. So
yeah. So, I mean, a lot of people also talk about photography being really difficult. What do I find? How do I find the right kit? All that. Did you yourself go out and buy it, or did your practice already have it and you could implement it straight away?
I've spent so much money on photography stuff.
I've seen.
I bought everything. I bought it all, and I just trial it all, and I have a problem. I have a photography problem. I just keep buying things and trying them out, and then it's out of control. Every time I see a new diffuser somewhere, I'm like, this could be the one. This is the one. And I'll buy it and I'll try it, and I'll be like, that's not the one. But yeah, it was a lot of trial and error. I've tried so many different types of flashes and so many different diffusers and different angles and different things, and it's all trial and error. And I look at my photos from a couple of years ago, and they were terrible, and they just keep getting a little bit better, and they keep changing all the time. But you know, I guess I'm in the search for finding like the perfect, the perfect photo, the perfect like setup or whatever. When I find that, I'll let you all know. But at the moment, my recommendations for something simple that just takes good photos and looks good would be whatever brand. Doesn't matter if it's Canon or Nikon, either your 60 or your 100mm macro, lens.
It's really hard to get 60s now.
It is really hard to get 60s. You got to buy them off like marketplace, secondhand.
The dark web.
Yeah. Man, I went to buy another one the other week because I wanted another one for a separate camera so I could have 2 different flashes going. And yeah, I couldn't believe it. They were nowhere to be found, and they weren't on eBay, and they weren't on the internet. So yeah, I was going on marketplace scouring. Like, now I'm going to say this and everyone's going to buy them. I'm going to go like get a little stockpile. I might start selling them to dentists at like inflated rates. But yeah, horribly hard, but it's a great lens. I love my 60. I use it for everything. And I know there's a lot of people, oh, you need to use 100mm. I don't know. It works good for me. I like it. I don't have to get too far back to take photos or portraits and things with it. It works really well, and it's lighter, which is nice. If you get your your staff taking photos, they'll complain if it's too heavy. But
yeah, I'm holding onto my 60 really tightly too. But
yeah, so flashes, I'm a big believer in twin flash. It just looks heaps better for everything aesthetic. I think at the moment, now that they've got the Go Docs, I think it's the MF12, which is really affordable, a really great one that you can, clip onto the edge of your camera, onto your lens without having to have arms and things on it. So that saves you a lot of cost. And then diffusers, subby hunts is the way to go. It's awesome. It's cheap. It's easy. Clip it on. Photos will look like you're a photography guru. Very easy. But there's definitely some there's some fine tuning to taking photos about, doing the right angles and doing them reproducibly so that your before and afters look right. And a fair bit of, knowing how to adjust settings for different situations and white balance and things. So I guess I take it for granted a little bit because I've always been into photography even prior to dentistry. But yeah, as far as where to learn that, I don't know at the moment.
Just trial and error sounds like is what you're saying. Yeah,
that's what I did, but it's definitely not the fastest way to learn something. It took me years to get to the point where I'm at. Whereas I feel like, I could teach what I've learned to somebody in a couple of hours and they would be fine. But I don't know if there's many photography courses out there. I think Sabi actually has an online one that he teaches.
It does, yes.
Yeah, so that'd be really good. He's super good. He knows his stuff really well. So that's what I'd probably recommend.
So okay, let's fast forward back into you're at Oasis Dental, right? You've got Bharat here who's encouraged you to join the team because he's said to you that, how are you going to achieve your goal of wanting to be an aesthetic dentist if there's no real map to it. So, okay, you've joined the team. What happens at this point?
From there, I worked, I think about 4 years maybe, with Oasis, which was great. Clinic is beautiful, had a great time, learnt a lot through there. Early on, I got a lot of mentorship from Bharat, which was, which is excellent.
Are we talking like aesthetics at this point, or are we just talking general dentistry at this point?
General as well, but with increasing focus on aesthetics. Early on, I was doing a few cases here and there, and then both the Invisalign and the other aesthetic treatments, bonding veneers, etc., was picking up. And the more that you do, the more that you do. Like you start doing it, people refer other people, you put some photos on Instagram and people start coming in, and it just kind of spirals like that. I think the more you do and you show people, and the more that you're confident in it, the more that you'll talk to people about it, and then the more that you do, and it keeps going.
Yeah. And along the way, I mean, I'm assuming he's going to encourage you to take more photos to document how you're kind of progressing and where you can fine tune it. Is that the case?
Absolutely, yeah. I think that was one of mine and Brat's like funny little connections, is that we were the two people that were both obsessed with photography, and always like I'd come in and have this new thing, and then Brat would be like, "What's that?" And then he'd come back in the next week with some new thing, and I'm like, "Oi, is it good? Should I get one?" Like he's the only other person that I've met that would have spent equal or probably more money than me on dental photography equipment. And we were always trialing, all the different flashes, and we get different things, or someone would send something to him or to me, and we'd be trialing this and trialing that to get what we use. But yeah, so there was always that kind of thing. We were trying to, we were kind of like pushing each other to do better, which is like the way that you want to kind of be with someone, I think.
Yeah. So, I mean, at this point, we've had someone else who's been through the Oasis Dental, and they've mentioned in the past that, there will be study clubs where they kind of, fine tune things, or case discussions about that. Is that how you found you were also learning for other people's mistakes or whatnot?
For sure. Like Niall, for example, he's really excellent. I really have a lot of time for Niall, and he's someone who's really good at presenting what he's done, and he's done a lot of stuff, and he's done some really cool stuff, but he's also really good at presenting what he's done wrong, which I think is really hard to do, particularly in a setting where you've got a lot of good clinicians around that are looking at every fine detail of a case on a really big screen. And he was really vulnerable in those aspects, that he could bring a case up and be like, "Hey, here's this case that I did, and this is what I did wrong, and these are the after photos. You can see XYZ." And and so it'd be like, wow, cool, and we can all learn, from that. So I think he's good at not only showing what he's really good at, which a lot of people have seen online or on DPR and things, some of the really really great work that he does, but yeah, I think learning from what not to do is just as or if not more powerful than seeing people's successes. So those things were really good. I think having a mentor or multiple mentors or people that you can discuss cases with like that just is invaluable, particularly for someone early on in their career, because if you can't bounce cases or your failures or successes off people, then it's really hard to learn from them.
Yeah, no, that's fair enough. And is at this point that you're starting to consider orthodontics more, and that's when you start to pick up that postgraduate diploma?
Yeah. So I was already doing like a decent amount of Invisalign at that point, and I thought I should probably do some further studies to like complement this, and also so I've got some kind of credibility for it. So yeah, I got into doing that, and chipping away at that sort of in the background. But I think learning while you're doing cases is just it was great, because I'd have these cases that I wouldn't be able to take on if I didn't have the mentorship of someone from this course to do that. Like Ryan Doran's the guy's name, who was helping and mentoring me, and he's just given me so much. Like that man, I've got so much time for. He has given me so much of his time to help me with cases that otherwise people would probably say, "No, don't take that case on," or this is kind of a bit out of your league, or "Oh, don't do that with Invisalign," or whatever. And he'd just be straight up with me and tell me pros and cons, risks, outcomes, and things that we'd kind of discuss. And so some of the cases that I've got that I finished from, even early on in my Invisalign career, there's no chance that I would have done them without the support and guidance of someone with a lot of experience. So,
So is he a general dentist, you said, or was he an orthodontist, or is he just a fellow colleague, or is he just in the program?
He's in the program. I can't remember what Ryan's position was. I swear, no, I don't know. I'd be gambling, but I know he used to work back in the day when Invisalign was lined up with Southern Cross or whatever it was, and he was doing. I'm pretty sure he was doing a lot of like, when people would have issues, they would send it to the them and say, "Hey, I'm having trouble with this case," and he was the problem solver, man. So
Mm.
for someone who's seen all the problems, I think that's the most valuable thing that anyone could have in just knowing when things are going to go wrong is probably, I think being able to predict that from the start, it takes the rest of it's easy. Like the actual treatment itself is so easy once you've planned it right. So
Yeah.
Yeah,
That's the hardest part, finding someone who's going to be able to dedicate as much, love and dedication to it as you would need to get the job done.
Yeah, absolutely.
Because as you probably mentioned, there's refinements along the way that, when things may not be tracking, you got the treatment planning, but then along the way, it may not track as well as you would like. And then you're like, oh, how do I problem solve this, right?
Because early on in my Invisalign treatments and things, when things didn't track, I was worried. You'd start seeing a gap on a tooth and a line and going, oh my God, what's happening? Did I do something wrong? Is the patient not wearing their aligners? What's happening here? I don't know. And then now it's kind of the reverse. I've already predicted that that's going to happen. If it's going to happen on a really difficult movement, the patient knows, and no one's concerned or no one's worried. We're like, if we think it might lag on an extrusion movement of a upper canine or something, I'm like, hey, this is probably going to happen. We'll address it by X, Y, Z. Don't stress when and if it does happen. We'll try and avoid it. And if it happens, we'll resolve it. And so it's really not stressful now, because if you can learn to predict what movements are going to be difficult and what things are going to cause you problems, then no one's concerned. And it doesn't become like, an excuse of you saying like, oh, I'm trying to make up some reason why things aren't fitting and patients are upset. So I think that, having that sight into it is really, really valuable.
Mm-hmm. Yeah. And I assume you were leaning on more than just one person, but there was obviously maybe some commonality in what they were saying to kind of piece it all together.
Yeah.
So at some point, as any clinician, they reach a point where they start to contemplate practice ownership or being a specialist or being a super dental GP, or even starting to think about starting a family. Can you share your thoughts on that?
Yeah, sure. I think a lot of us, as well, the type of personalities that often dentists are, everyone's kind of pretty big goals and dreams and driven and motivated and things. And I think, some people are very happy to work hard and work in a business where they don't have to, think about all the staffing issues and all the overheads and costs and advertising. And so, all of that sort of stuff that comes with, there's a lot of work that goes involved. But for me, I like that sort of stuff. And I like growing things and making things. And it's not particularly just about me so much. And so, yeah, I just found that, I was more interested going along and like, hey, what if we did like this kind of promotion, or what if we introduced this or tried to do that, or, start having all these ideas. And there comes a point where it's difficult to do that for somebody else's business, and it's their business at the end of the day. You can't like hijack their thing with your own ideas and expectations. And even though if it may benefit, which is great, but at the end of the day, you can't
it's their baby at the end of the day.
Exactly. And everyone's got the way that they want to run a practice and their ideals and everything. So it becomes a hard point. And do you either settle and say, look, I'm cool to, just follow the lead and be comfortable. But for me, like, once again, going back to what we said before, comfort, I get too comfortable, and then I need something to grow and to challenge me, and a little bit of risk. I don't think you grow in the comfort zone. So that was kind of always going to be there was a long time where I said, oh no, look, I'm like, because I had such a good gig at Oasis that I was like, I don't see why I would leave. Like, I've got this great job, love it, I've worked my hours that I want to do, I've got great patients. But slowly it grew, and you get to the point where I go, I think I need to throw myself in the deep end. I need to grow this thing for myself and start from scratch. And it's a whole new chapter now, but it is really rewarding. And I'm having a lot of fun with it. It's kind of re-sparked a whole new, excitement for dentistry in, like you said, growing it like a baby. It literally is like a baby, and you've got to throw so much time and effort and resources, all your money, all your time, gray hairs at it, and to see it grow. But when you start to see it growing and things doing good and people saying, hey, look, like this is really cool, like you've done really well, it's like very rewarding. So yeah.
So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you in the next episode of CPD Junkie podcast. Thank you.